From service to strength, from questions to choice, guidance you trust, her vet voice.
Hello, 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 everyone. Welcome to Her Vet Voice YouTube channel. Thank you guys for joining. I hope you had an amazing day. And we are getting into great discussion tonight about um, conditions that men do not file. So it is Women Wednesday, but we decided to include the men tonight. How are you doing? 66. Thank you for your love. Everyone is here. Drop me a hi in the chat. Let me know that you're here. If you are on TikTok, you can come on over to YouTube. And we're going to get the conversation started. And you guys know FF and Natural is here with us on YouTube, and we're going to probably have to answer some questions and get into the discussion. So before I get started, we are going to get into it, okay? Because we know that there are many VA benefits that go unclaimed due to the lack of awareness and the stigma and the misconceptions that male veterans have, okay? So when we talk about the key benefits that males can file for, there are so many, and like we talked about last week, there's so many that women can file. So let's talk about some of the common conditions that male veterans need deal with that don't always get claimed right away, right? A lot of veterans are walking away with symptoms, and they're walking around with symptoms that really they don't even realize that they qualify for VA disability. So tonight we're going to break down 6 major conditions that you need to understand if you're filing for an increase or if you're filing your first claim, what to do. And the 6 conditions that we're going to talk about is PTSD, the musculoskeletal, Agent Orange, and everything that goes along with it, the Gulf War, TBI, and migraines. And we can also include erectile dysfunction because that's part of one of the conditions that men really don't want to file. So many veterans really don't know what to claim. Some claims are underrated. Many conditions are connected or they're secondaries, but they don't even have a clue of how to either connect it or if it's a secondary or even if it's really something that they should file. So it's not just about having the condition, it's about understanding how do you claim it. So, hey Natural, hey FF, let's get into the conversation.
Good evening.
Hi. All right. So, one of the most common misunderstood that we're going to talk about when it comes to men, okay, is PTSD and mental health. As we know, men really don't like to go see a physician. It is very challenging for when a man has something going on with him. And this is not a man bashing season, this is just the reality of it. Some men really don't like to go to the doctor. And so it is a problem with getting the medical evidence that they need and making sure that they have the documentation they need for their VA claim, right? So symptoms, how it affects their work relationship, the VA rating based on the occupational and social impairment. This is usually a problem that men encounter. So, ladies, let's talk about PTSD and how it is not one of the things that men really think that they have, and how it is often a struggle for men to file for PTSD. Let's bring up the slideshow here. So we have a PowerPoint to talk about PTSD and mental health. And let me expand this so you guys could see it. Let me make my screen bigger. Okay. Can you guys see that? Is it big enough? Natural, can you see? Oh, you can't see the screen, can you?
Yes, I can see it.
Oh, okay. Is it big enough? You can't. Can
Yeah,
you guys see?
I can
Okay.
see. Back it back a little bit.
A little bit more. Okay.
Yeah.
Is that
There
better?
you yeah.
Okay. Good. I want to make sure that it was good. Okay. So the stigma and lack of awareness lead to underclaiming symptoms such as flashbacks, anxiety, depression. Service connection can be established through deployments or traumatic events. So let's talk about depression, anxiety, adjustment disorder, MDD, and talk about how men often underreport the health symptoms due to the stigma or belief that they are going to tough it out. So most of the time, men have a problem when it comes to good evening. When it comes to filing for their disability, when it comes to PTSD and mental health. There are so many different conditions, and we have them here listed on the screen: depression, anxiety disorder, chronic adjustment disorder, bipolar disorder, obsessive compulsive disorder, eating disorders, schizophrenia, and suicidal ideations. Men struggle with that. Natural FF, do you have some input as to why they struggle and how we could get past the fact that it's okay to file these things without them being judged?
Just really quickly, I think they may see it as a sign of weakness,
Mhm.
which it's not. Mental health is very important. And something, I don't know if it's something inside that says I'm less than a man if I go to somebody and address my concerns. It's not whining. You're telling what you're experiencing, and it's better to get it out than to keep it in. There's no judgment when it comes to the VBA as far as your decisions, but just in your regular life, make sure you speak with somebody because your mental health it kind of runs into everything else. You don't want to be around people, you want to talk to certain people, uh, maybe even skews the view of a certain thing if we don't discuss our issues with someone.
Mhm.
But I just want to say it doesn't make you less than a man. I think it makes you better because now it's in the open and we're actually acknowledging that something is going on, whatever that condition may be. And it's okay to get help.
Thank you for that, FF. Natural?
I think what FF said is absolutely correct. I think a lot of men suffer in silence because they fear judgment. They don't want to look weak to their if they have a significant other,
Mhm.
or to their children. If their children, look up to their uh father and they feel like they have to wear this shield like they're Superman, and they kind of neglect themselves from getting help because they feel like they have to be seen. Sometimes when kids men are being brought up, they are taught, you can't cry, you can't show weakness, you can't show emotions. So it's instilled in them that they can't show any weakness. Now if they're in the military, fear of not being able to have a command or be a NCO or get promotions, because they have this label of they're going to get, help for mental health. So a lot of men put those things on the back burner, you know, um, because they want to progress in their career. Depending on what type of career they have, a lot of them can't have the mental health, like police officers and stuff like that. They can't have that type of mental health diagnosis because it may be where they can't carry, and so a lot of them will put that on the back burner on, to keep their career from, going by the wayside. So I think it's just fear.
One of the things that I really see when it comes to men and not filing for their disability is that the effect that it has on their family, right? When you are a man and you're married and you have kids and you are trying to mask or trying to tough it out as to what FF and Natural said, it can have a very huge impact on your family. Okay. So you may not feel like you're lashing out at your spouse and your children when in actuality you are. You're not seeing it in the same light that you are. And I often talk to a lot of women when their husbands are doing consultations about especially their PTSD or they depression and anxiety and frustration, even also, and we're going to get into this a little bit, Natural, substance abuse, right? They're drinking more, are they using different types of substances, and they don't see it as they're lashing out or they're being, you know, mean to their family members, but in actuality their wives and children are facing, you know, this type of behavior or this type of treatment from them. And your mental health and the stability of your mental health is very important when it comes down to making sure that you are okay and your family is okay, because your family is your priority, right? Outside of your job and outside of everything that's happening, you need to have a solid relationship with your wife and your kids. And I see a lot of men even on social media saying, well, you know, my wife left me and this is what's happening, because they're masking the PTSD and they're taking it out on the wrong person. So it is imperative, and this is why we're having this conversation tonight, that men really take the time to see a therapist, okay? Because men don't really talk a lot about what's happening to them. They don't really, unless they have a man figure that they're going to talk about. And I know when you're going to see a therapist, if it's a woman, you might not feel comfortable, but this is a situation where you have to be able, right? You have to be able to voice exactly what you are experiencing and what you're going through, because you want to be better. Two, you want to have a solid relationship with your kids and your wife or your spouse or whoever it is. And three, you want to sleep comfortably at night, right? So when you have all of these things going on, anxiety, flashbacks, depression, then your blood pressure starts to get high, you know, all these different things starts to happen in your body. You become sick, and then things just start to go downhill. So it is very important, right, that you go see a therapist. You file for your PTSD. I recently had a young man, he had gotten out the military about 18 years ago, and a weapon was pulled and he was hit in his chest, and he didn't say anything about it. It was reported, and he was like, I didn't say anything because I don't want people to think like I'm a punk, like I wasn't able to like defend myself. And I'm like, look, nobody is looking at you as not being able to defend yourself. Here's the situation. It happened to you. Obviously, something about it is really, really tearing you up on the inside because you're not able to function in the way that you should. I suggest that you talk to a therapist. He went, he did his therapy sessions, was rated 70%. He was like, he could not even believe it. And life is so much better. His wife was like, life is just so much better. So while we're in this conversation, Natural, and I know FF, you're getting ready to go, let's talk about how the impact of substance abuse, it ties in with the PTSD and the different mental health conditions.
I'm gonna try really quickly.
Okay.
But yes, it's a mask. It's a cover up. It allows you to feel like you're doing something without actually doing something, and it also gives you a reason for the behavior and those modifications.
Yeah.
It's like the worst crutch, and I know we all deal with those situations differently. But when you see how others respond, that's kind of the first clue, like, you know, hey, maybe I need to switch up what I'm doing.
Yeah.
And if you're not sure about it, just, you don't have to get a journal, but you need to write it out so you can see it.
Yeah.
And then you can visually see the impact that you're having. Like, why is my wife or why is my family, why don't they want to be around me? My coworkers, my friends.
Yeah.
Like, you're prioritizing everything except your health.
Yeah.
And that's very important.
Yeah. Thank you, FF.
Me, what I think is men sometimes they don't realize they have the issue because they have become accustomed to how they feel, and they try to minimize it by drinking, or you say like the substance abuse, or others around them don't acknowledge it and they just like, oh, that's how they are. Oh,
Yeah.
I'm used to it, instead of trying to get to the root cause of the problem. And it ain't just men. So I
Yeah.
don't want everybody to think
Yeah.
we're
Yeah.
just on the topic of men, because there's women that have the same issues.
Yeah.
But men sometimes are the ones that seek help the least.
Yes.
Men are the least ones to claim mental health, but if they do claim it, it's way years later. Like,
Yes.
they're well off into their age, and then it's because other people have pushed them.
Yeah.
I read so many lay statements from the family members on how they talk about before they went into the military, they were this outgoing person. They played football. They did all this stuff in the community. They were, and then they go to the military, and Lord forbid they went to, combat, or whatever. They come back a total different person. And personally speaking, I did too.
Yeah.
I'm not the same way that I was, because you are exposed
Yes.
to different, elements, different fears, different things. I don't care how strong you are or how fearless you feel like you are. When you are put into that situation, you're going to have to face fear daily.
Yeah.
And that's a matter of survival. So when they put you over in a country that you know nothing about, and you have to protect yourself as well as others, and then they bring you back to your environment, and life is still going on here.
Yeah.
And your family is still growing, moving, they're doing day-to-day things that's normal. And then you get put back into a situation where, like, you went from, a year of every day you're hearing sirens going off, you're hearing, other stuff going off. I don't want to say on your channel, but and then you get put back into an environment where it's the norm, versus and so you yes, they want you to switch that switch off, and it's hard.
Yeah.
It's hard to disconnect from that after you've been living with that way for months, and then you get put back into your family dynamic. Well, sometimes the spouses, it's hard for them also, because they have not that they don't miss you, but they have created their own type of schedule, their own plans of what they have scheduled for them, and then they have to introduce you back, and now they have to pay attention to you, and then they notice, okay, this person is drinking a little bit more, they're moody, they're lashing out, they're driving erratic or whatever. They don't understand, because your mind is still somewhere else. And for a soldier or a veteran, that's normal for them, because that is the way that they have programmed themselves to be. And then they want you, and that's why I feel like the military needs to do a little bit better when it comes to redeploying soldiers and putting everybody into some type of counseling before you either get out, or if you're going to stay in, they should make it mandatory that you go to some type of therapy when you come from conflict. I know soldiers have went 7, 8 times. Myself, I went 6.
Oh my gosh.
So, it's different. It's a mindset thing. You think about, you riding down the street and a piece of paper blow across and you're swerving, that's normal to others, but to a soldier, it's like you're you see something in the road and you're swerving not to run over it. So a lot of the mental health that men go through, for them, it's like, okay, I can't talk to nobody about this because they're not going to understand. I can't talk to my spouse about it because she's not going to understand. To me, I feel like if you have 2 soldiers in the military and they're married, I feel like they can understand each other, versus a person that's not in the military and their spouse is in the military. You can't explain to them what you're feeling because they've never experienced it. Although they can sympathize, they just can't really understand why you are not you anymore.
And I just want to say this. This is not only for men, okay? We're just talking about men, the conditions that men don't file. So we know that women in the military go through the same thing and men don't understand that as well. And we spoke about that last week. So if you're just joining on TikTok, we are live on YouTube where you can come over and join us and get into the conversation. We're talking about the conditions that men actually don't file and how PTS has an effect on, their daily lives. Before we go over to the next topic, I want to let the men know who are here. If you have a substance abuse problem, you are not going to be criticized because you have a substance abuse problem. Okay? File your VA claim. If you have a substance abuse problem, you need to seek help. And the reason why I'm telling you this is because if in your CMP exam, okay, if you are saying that you're using substances, they're going to annotate that on the documentation. They're going to annotate it. And I want you to know that there have been annotated it. And Natural NFF could tell you that they annotate when you use substances. So
Yes. And really quickly, I'm about to go, I think, but really quickly, pay attention to your mental health, because I know we're discussing drugs and alcohol, but it's other identifiers. If you find yourself maybe engaging in more reckless behavior, maybe you start spending more time, with people in an intimate fashion more than you did. Sometimes that can be signs like, am I feeling defeated? Am I depressed? Am I sad with myself? Am I unsatisfied? So when you notice that there is something that is harmful to you that you continuously engage in, just try to track it
yeah,
so someone can help you.
thank you. Before we go on, we have a question here. Does does a claim need to be active on the problem list to get a CMP exam?
No. So with BDDs, if you're in the military and you claim something, say hypothetically, since we're on mental health and you've never seen anybody while, if you claim it on your form, if you do the DBQ while you're on active duty, we count that as a in-service event, and we'll count that as part of your active duty enlistment. It doesn't have to be mental health. It could be anything.
Yes.
As long as you have a diagnosis and it occurred while you were on active duty, then file it while you're on active duty.
Awesome. Thank you for that. All right. All right, let's go to the next question. Okay, so let's see what Angel said. Spot on, ladies. Thank you kindly for your support. It took me 25 years after service to seek VA. Now I'm better. I'm better for it. Brothers, don't be like me. Be better. Thanks again.
Amen. Thank you. Thank you for sharing. And you know what? I have so much respect for men that step up and acknowledge that they've had a problem and they went to get help, and they are educating our fellow soldiers and veterans and even the younger generation coming up, because like he said, don't be like him and suffer that long without, depression and anxiety and all those things that can take a toll not just on your mental but your whole body and cause other disabilities to manifest. And you can and people have lost everything because they did not go seek the help that they needed. They were remorseful after, and what they'll do is just isolate more, and sink further into depression. I know the VA don't have a good, with the healthcare, but they do have programs that you can go into. A lot of VAs have that domiciliary program, the rehabilitation program, where you go in and they treat you and you get therapy, during the day. They even give you employment while you are in the program. And a lot of times that employment turns into full-time employment once you complete the program. It ain't 100% great because things still do happen, but I advise anybody, don't wait long. Just go seek the help. I mean, it'll help you, your family, and like I said, you can become a voice to speak out and be the one that, your story could help another fellow vet that's suffering.
Yeah.
Just seek the help, guys.
All right. Katie North sent us a message as well. I have double mental health issues, military and retired law enforcement, constantly in therapy. My family strongly encourage it. And I'm glad you have the support of your family. It is definitely needed. Definitely needed.
Yes, I'm glad she said that too, because not having a support system is another thing that sometimes as veterans we all lack, and if you don't have that strong support system when you're going through that to help, encourage you, push you, drive you, to go to therapy and be there with you through, your roller coaster.
Yes.
It's hard for veterans sometimes because they don't know where to turn.
Yeah, they don't. And they need somebody, and you need somebody to tell you what you need to hear and not what you want to hear, right? You need somebody to tell you, hey, this is what you're going through. This is, you need to see somebody. And while we are at it, I wanted to pull up this article here. Hold on, y'all know I be struggling with this YouTube situation because I'm new to it. But here is an article here that is talking about the SFPD cop who used his disabled placards could be fired after suspension. Okay. Officer Mark Plummer claims he's being retaliated against for asserting his rights as a veteran to use the placard. The San Francisco Police Department has suspended an officer who is under investigation for insubordination related to using a disabled parking placard on his car, despite being fully able to perform his duties. Officer Mark is one of 5 officers who got into hot water in 2024 after it was discovered that they had received and were using disabled placard parking via their disabled veteran status. Some initially refused to give up their placards or provide proof of their disabilities, even after being ordered to do so by the chief. Their special status is meant for those whose disabilities significantly impair mobility. However, Plummer continued to complete his biannual physical evaluation and work full-time as an officer. Plummer was suspended on March 4th, pending an investigation into allegations of insubordination due to his refusal to provide proof of his disability, which could lead in his firing, according to attorney Matthews Nichols. They just don't want to admit they're wrong, Nichols said, describing the suspension as retaliation after Plummer fought for his rights to use the placard. Officer Plummer claimed he is being retaliated against for asserting his right as a veteran to use the placard. They're trying to send a message to everyone else: get in line or else. The San Francisco Police Department did not respond to the request for comment, but the department disciplinary penalty guidelines says the first count of insubordination can result in termination. The group of officers involved in the case filed a suit against the San Francisco Police Department last year, claiming discrimination and retaliation for fighting the department on the issue. At least 5 active duty officers hired McNichols, who call his clients heroes, couldn't face scrutiny for an honor earned. Only 2 plaintiffs were named in the suit, Plummer and Stephen Ostris, and who have since returned to duty after providing the department with proof of his disability. The reason why I brought this up is because a disability doesn't have to be something that's seen, right? You can be rated 100% for mental health. You don't have to have a visible disability in order to use a placard. This is the prime example for men who are also in law enforcement, like Natural talked about earlier, who are doing a job, yet still disabled and doing a service to our nation. And guess what? They're scrutinized because they have disabilities. So I want this to be a learning exam, a teachable moment for, despite of you having a disability or whatever the case may be, you can still do your job, and it doesn't have to be something that's visible. And I know a lot of people, when you have, for instance, when I worked at a previous job, due to one of my disabilities, I had a placard, and this lady, she saw me get out the car, and I walked in fine, and she was like, "There's nothing wrong with you." And I said, "Well, you don't get to tell me if there's something wrong with me or not. Okay. The VA has already determined that there's something wrong with me, and they saw that I should get this placard." And I wasn't going to expose my medical information to this lady, but people often look at us veterans and say, "Oh, there's nothing wrong with you, so you just need to park in a regular parking spot." But nobody understands the respiratory stuff that you go through, the mental stuff that you go through. That's not visible to the eye, but it's a disability. Okay. And I know that people criticize veterans when they get out and walk comfortably, but nobody's there to understand the mental turmoil that you have going on, and the rest of the stuff that you have going on. So this is where it is definitely an imperative that men. Oh, hey, Mr. Kimball, thank you for joining. I thought I would show support. Thank you for sharing. No problem. Thank you for joining us. It is very important that men, when it comes to PTSD, when it comes to depression, when it comes to anxiety, all those things, you have to go see a provider. You have to talk to somebody. And oh, thank you. The stigma is that men don't like to go to the doctor, or if there's a woman therapist, they don't want to see a woman. Well, guess what? If you have a woman therapist and you don't like it, you have the option of community care. You can ask for community care. You can ask for a male, because sometimes men want to have men-to-men conversations. Just like women want to be seen by a woman OB/GYN, men should be given the same preference when it comes to who they want to see for their mental health. So if you are a man and you're here and you're struggling, and you have went to the VA and they provide you with the female therapist and you're not happy with it, I want you to sound the alarm. Let them know that you're not comfortable, because it is best for you to talk to somebody than not to talk to anybody at all. Okay? And I want you to muster up that confidence to talk to somebody. It's imperative that you do. There are too many men who have served in the military that definitely need to be seen, they need to be heard, and they need somebody to talk to. And so life will be so much smoother. Your family life will go so much smoother if you just talk to somebody. And this is the reason why we decided to do this live tonight, to talk about the conditions that men really don't want to address, but needs to be addressed so they can file their disability claims. All right, so we are going to keep going to the next one, which is, I think it's musculoskeletal. Let's see here. Yeah, I had to give myself some notes because I couldn't remember everything. So the musculoskeletal injuries, like the back, the knee, the shoulders, these injuries often come from in-service, and they often go unclaimed because veterans push through the pain. And you know how you push through the pain, because I want to tough it out. I don't want nobody to see me limping. I'm not supposed to be seen as broken. I'm not supposed to be seen as hurt. I'm a veteran. I'm strong. I'm tough. Absolutely not. If you continue to toughen it out, these injuries are going to get worse and worse and worse. Natural, you want to say something?
Well, I was just going to say, you would be surprised how many people, this men, but how many people were, limping and they tore something in service, or they had fractures and they continue to push themselves with with these ailments. And when they get out, they never went to see anyone while on active duty.
Wow.
So it makes it harder for them to get service connected for these disabilities, because you didn't have you had an in-service event, but you never went and got treatment. Now they manifest for years and years and years, but you know, you get out and you have to provide for your family. So you go to work and you continue to have these ailments, you know, and as we, you know, Father Times and Mother Nature come, and you know, you start having all these groans, and you get up in the morning, you're so stiff, and you relate it back to a man. I remember when I fell off this truck when I was in active duty and hurt my back, or I remember when I was lifting this and that and I hurt, you know, and the gear that we wear. Oh man, I remember this. So just because you might not have had this, you didn't complain about it or whatever, sometimes depending on your job in the military, you can relate it to the job, like infantry, combat, tankers, those big artillery shells they had to lift up to put into the, you can relate some of these injuries to your job that you had in service, or you can have lay statements from people who witnessed you got hurt. Sometimes it works, sometimes it doesn't. But if you know that, because even on your separation exam, you'll be surprised how many people write on there like, oh, I'm in great health, and then they just get out. I don't know if they're just be in a hurry to get out, but a lot of those separation exams have saved a lot of people and had them get service connected, because they indicated back pain, knee pain, shoulder pain, anxiety, shortness of breath, and that is considered a in-service event, and that is enough for a exam and a medical opinion. Because if you have care now and it shows any of those things, you have a better chance of getting service connected for it versus you have nothing in service. And one thing about musculoskeletal, you can't claim it under terror because it is a pack exclusion. Musculoskeletals are seen as trauma. They're not seen as a toxic exposure. If you had, well, I'll wait a little bit, but you know, just be mindful if you're still on active duty and you have any of these types of injuries, please go get seen. And that's it.
And do your exit exam. Do it.
Please. A lot of people do get out and don't even do that. Their separation exam. I don't understand. You know what? I know sometimes when it's close to getting out, because I was so ready to get out, but I did do my part 1 and part 2 physical. And it, you know, a lot of things that were indicated on that I had never even went to get seen for, but because I noted it on that, I was able to, you know, link it to service. So I know that men, you know, like we said earlier, you guys are the superheroes of the family, but don't neglect your health, you know, because as you get older, like I said, these aches and pains get really, really worse. And then I'm seeing a lot of people coming in, you know. Oh, and another thing I would say, if you was a parachutist, if you are airborne, those are in-service events that we can use to service connect musculoskeletal, because jumping out of airplanes, you could have landed wrong. So I've service connected personally people with those types of indicators from the military. So
let's see a few comments here. I remind people constantly when they challenge me about my parking, all disabilities are visible, and give them a stare stern. Absolutely. Mr. Kimball said that he rated so many males with MSD claims more than females.
And Mr. Kimball, I'm starting to see that a lot myself, especially with Navy veterans.
Yes.
In my opinion, the Navy veterans are I'm not going to diminish the other branches, but the Navy, in my opinion, that's where I've seen the most MST claims come from men.
Yeah, correct. I've seen a lot during my consultations. The men that I have been consulting with, they're definitely from the Navy. Correct.
Yep.
Navy stabbing, the Navy. Yeah, the Navy is a little brutal now. They're a little brutal.
It is. And some of the people who suffered in the Navy, like especially back in the 60s and the 70s, some of the stuff that some of people of color went through was crazy.
Yeah.
And trying to get that stuff service connected now is probably the hardest thing because of the discrimination, the beatings, it's just it blows my mind, like, the stuff that people are like in their 60s and 70s and 80s are coming and saying, and the stuff that they had to go through while in the Navy, and the brutality that they suffered is it just, the Navy is, whoo.
The Navy is definitely, he said the Navy was the worst branch when it came to MST. They would put pen to paper in that area. Down Dog said he didn't start going to the doctor until he was 50.
Right. And I'm sure he's got a lot of probably ailments, because he probably just pushed through everything and continued to work. And yeah, I know.
Yeah.
Well, I'm glad you're going now, though.
Yeah, and it's good. And guess what, guys? It doesn't matter how old you are. The fact that you are now taking the initiative to go, I just want to commend you for going, right? I want to commend you for taking the step to go in to see a physician. It's imperative. Some of the joint injuries that musculoskeletal injuries are the shoulder, the ankle, hip. Men often push through injuries during service and never report them. They are among the most common disabilities by branch, but still underclaimed. Chronic back, neck, shoulder pain, hip, knee, and ankle pain, limited range of motion, degenerative joint disease, and arthritis. Many male veterans normalize their pain from years of physical training, like airborne operations, rucking, or heavy lifting, and never file a claim. There's so many men that I meet that have never filed a claim before. Never. And the reason why they're filing the claim is because their spouse is pushing them to filing a claim. I think I just had a guy who's been out of the military since, I think, 1983. And he's just contacted me to file his first claim since 1983. Never filed a claim before. Talked about MST that happened while he was, in the military. Never filed a claim. And the only reason he filed a claim, he's starting to bill it because he saw me on TikTok talking about MST and how other men, experience MST. So
I would add, I'm
Go
sorry, I would add PT to this as disabilities that go unclaimed. A lot of time when we're doing PT, that's a lot of stress on your body. All those long runs, all the physical training that we have to do, you get injuries, rotator cuff tears, meniscal tears, fractures in with your shin splints, broken ankle, and you keep going. You just tie your boots tighter and keep going. So those injuries have went unclaimed, and now you have deformities. Now you have degenerative arthritis, and all these different ailments that you can't explain. But if you take time and think about it, you'll remember some things that you experienced on active duty.
Yeah. And one of the things too that I tell a lot of males is that you may not remember that you've experienced it, but when you get those medical records and you start looking back through it, a lot of things come back to recollection. And I tell a lot of military veterans this: get your your medical records are important to you, because there's so many things that could have happened to you over the years. Say, for instance, you've been out the military for over 30 years. Obviously, you're not going to remember every in-service event that happened to you then. But I'm sure once you start to review your military records and you start seeing things that's been, that you went to the doctor for, so many different things will start coming back to recollection. This is why I say it is imperative to set a timer for at least 10 minutes out of your time, your day, to start going through page by page of your medical records. Too often, service members overlook stuff, or they don't remember that it's there, and then they're trying to figure out, what else do I file? And then I said, well, did you get your military records? Oh no, ain't nothing in there. And then when I say, well, let's go ahead and apply to get them, they get them like, oh, I didn't remember this. I didn't remember that.
I agree, because I get claims and veterans will claim like tinnitus and hearing loss, or they'll claim tinnitus, hearing loss, and a back injury. And I'll go research in their records and I'll see all this. I'm like, why didn't they claim this? Why didn't they claim that? Why, if they had claimed this, that, and that, they would have had a better chance of getting service connected for those things versus the things that they've claimed. So I totally agree with her vets when she says this. If you don't have your service treatment records, put in a request to get them. It may take a little while, but you're filing claims now and you're getting denied, you're getting denied. Stop doing that. Get your STRs, your service treatment records, go through them. You'll be surprised of things that happen that you don't remember. It could be simple as something like, oh, you hit your hand and now you were lifting up something and tore a ligament and you didn't remember, and now you have carpal tunnel, or you have arthritis in your hand, or just something. And take the time, and then you're receiving care now or a PT for it, and you would never know. You never know that I could have had service connection for this because of you don't remember. So I would probably get them because, like Mr. Kimball is saying here, that's exactly what we look for. We try to link it direct. If we can't do it direct, then we look at presumptive, and then we go to Terra. But like I said, musculoskeletals are a packed exclusion, so Terra doesn't count.
Raiders will look for complaints, treatments, diagnosis, events, or injury in service. I would go there first to confirm the link in the service for the DNET. Correct.
Yes. Absolutely.
No, not meaning your C file. What do you mean?
Well, excuse me.
As well.
That's what we call it, the C file. And the service treatment records are a part of the C file. So if you put in a FOIA request, although FOIA takes forever to get,
it does.
Yes, but you can still put it in. I'm not saying that you can wait 2 years or whatever to get the claim, but if you go ahead and file it now, even those that are 70, 80%, 90%, whatever, because that a struggle from 90 to 100 is a struggle sometimes. And what happens is you guys continue to file claims and claims for increases on things that you should never come back and file an increase on, and end up getting reduced because you're trying to get that last little bit to get to the 100, and you're sitting yourself back, Skin
said, in the military, your sergeant or first sergeant discouraged you from getting treatment and you didn't want to be the weak link. We're out the military, guys, so we have to break that mindset and get care. Well said.
Absolutely. Absolutely.
And sometimes when I'm on TikTok Live, I get a lot of service members that come in and they're preparing to get out, and they talk about how they're being bullied, or how they're being looked down on because they're asked to go see a doctor due to something that they're experiencing. And I always encourage them, the opinions of others don't matter, right? Your health is your wealth. And I say this so many times here. If you are not healthy, you are not wealthy. I don't care how much money you have. I've seen where people have thousands and millions of dollars and their health is terrible and they can't do anything about it. Your health is your wealth. Make it a priority.
And let me say this. Let me say this. What I would say is that first sergeant or that sergeant or that commander, are they going to be with you the rest of your life? Absolutely not. I know that when you're in the military, yes, it is discouraged, because if you're trying to get promoted, or you're trying to, if you're trying to go from enlisted to officer, or you're trying to get a command, all those things are looked at, how are you 100%, in this area? So a lot of people push that stuff on the back burner and continue to drive. But when you get out of the service,
Yeah.
you got all these injuries and all these mental health injuries, and now you cannot link it to service when you know that it happened. But
Yeah.
because you don't have the events and the diagnosis and the treatment and service to back up what you're going through now, a lot of veterans get denied.
Mm-hmm. Yep. Natural keep getting those production points. It was a nightmare when I was the RO 317. Oh, Dwayne. He said he might be showing his age earlier. I guess they used to, when I first started rating, we used the RBA 2000 and then went to VBMS. Great information covered this evening. Thank you, Mr. Kimball. 66 said being out for some years now. Definitely actually can look from the outside in and see how we are programmed. Absolutely. You don't see it until you're actually in it, right? Taz, if you want to discuss BDD, guys that are on TikTok, you have to come over to YouTube to put your question in the chat because I'm not able to manage both screens at the same time. So it's definitely a challenge. Okay. So you can come on over to YouTube. All right, let's keep going, guys, because we are making some progress here. So the next we're going to talk about is the Gulf War illnesses, because we get a lot of questions about this. And a lot of people get the Gulf War and the PACTAT mixed up. And, natural be like, it is not the same thing. So we're going to talk about the Gulf War and how it's eligible and what era is eligible. And many veterans unaware of the presumptive conditions. Symptoms include like fatigue, joint pain, memory issues, and digestive disorders. It applies to veterans who serve in Southwest Asia. Respiratory conditions such as asthma, bronchitis, linked to burn pits, dust and sand, and chemical exposure. Many veterans don't realize these can be service connected. Burns, surgical scars, rashes, fungal infections, and dermatitis are often overlooked. Scars are compensatable even if they don't hurt. That's a big one. GERD, which is IBS and IBS, common among deployed veterans due to stress, diet, and environmental exposures. Many veterans don't realize that these service connected can be service connected or secondary to PTSD or medication, to include neurological conditions. So let's start talking about the respiratory conditions, right? The chemical exposure. Natural, you want to talk about that part?
So with Gulf War, these are called presumptive conditions. We presume that these happen because you were, like it says, in Southwest Asia. And that and Southwest Asia encompasses a big area, guys. That includes Afghanistan. I call it K2, but it's a word that this country I can't say. But Uzbekistan, all those things. So when you're there, they have the bad sandstorms. You breathe in all that. Then that sand is like glass cutting you. So think of you inhaling that, and it's in your lungs. It's irritating. Now, some people had asthma, and I see a lot of people notate that on their entrance exam. They had asthma as a child. Now, if you come back and you have asthma and you're claiming it due to a Gulf War exposure, what they're going to do first is ask for an aggravation, because it was indicated that you had it prior to service. That's a must. You have to do it as a aggravation. But if you did not, then we presume those things happen. So if you have like a diagnosis of asthma, bronchitis, sinusitis, rhinitis, those things are presumptive. You basically have to have a diagnosis of it.
Yes.
To get service connected for it.
I hope you guys got
sleep
that.
apnea. Not sleep apnea. Let me be clear.
To say, not sleep apnea. No. And I want to say this: sleep apnea is respiratory, guys.
Yes.
Even though it's called sleep apnea, it is respiratory. It's in the respiratory family. And I see a lot of people that say, oh, they put my asthma and sleep apnea together. Why they did that? Because asthma and sleep don't go together. And a lot of veterans don't know that sleep apnea and asthma sometimes can be rated together.
Yes, we have to rate them together because it's called pyramiding. The symptomology overlaps. And
Yes.
that's why if the examiner says that he cannot give a distinction between the two on which one is causing you the most, we automatically put them together and we rate whichever one is more advantageous for the veteran, which means is which one is the highest. That would be your primary. And sometimes they switch. Because, like, if you have sleep apnea at 50 and you come back and you claim asthma, and asthma may be rated at 30, we will put it together. It'll be OSA with asthma or OSA with bronchitis.
Yes.
You can never get them rated separately. It's called pyramiding, and it's a law that permits us from doing that.
Yeah. And I'm glad we talked about that because again, a lot of people in my inbox saying, why they put these two together? Sleep apnea is respiratory. It doesn't,
It is.
even though the wording says sleep apnea, it is respiratory. Okay. Let's talk about the scars.
So with the scars, sometimes veterans, they had a surgery in service. They may have had a knee, and even if the women, this goes for the women, if they had a what is it called, a C-section, that scar can be service connected. If you had surgery on your shoulder, you had something removed, you might have had a keloid removed in service, you may have had a wart, you may have had, I don't know, if you had a surgery for scoping your knee and that scar is still visible, and it may be tender upon palpation, which means if somebody touches it or your clothes touches it and it causes you pain, you can connect that. Now, typically, if a scar doesn't have pain, then it's rated at 0%. It's still a percentage. It's just a non-compensatable service connection. And as far as like fungals and stuff like that, you know, sometimes people get athlete feet being in service, or they get a toe fungus. All those things are service connected.
Yeah, and people, I see a lot of males too, who have been doing consultation with, they have fungal infections on their back. So it's not only on like your feet, or you know, they can have it on their skin, on their back, or on their chest area. Sometimes the fungal infection spreads to different parts of your body, and you can get the fungal infection over, you know, all over your body. So look out for where, you know, not only for athlete feet where the tinea is in your toes, it can spread to your body parts as well, right? Because if you use a towel to dry your toes and use that same towel to dry your, you know, your body, you can get that fungal infection over your body as well. So be careful with that.
And also, I would say PFB, which is that pseudofolliculitis, that came from when the men had to shave with those razors.
Yes.
And some men's skin is very sensitive, and some people have profiles against shaving. That is a service connected condition that a lot of men don't claim also, even though wasn't on the slides on the skin.
Yes.
That is a compensable, because if you come in and you have those outbreaks, we go on body percentage, how the area of it, how much area, and then some men have from that shaving profile, they have scars from that on their face. It's called disfigurement. So those are things that can be claimed also.
Okay, GERD.
Oh man. So GERD.
Okay,
so GERD.
Y'all know why we saying that? Because it's been a rough ride with GERD, because the changes that they've had with GERD. So go ahead, Astro.
So GERD is one of those things that you can get service connected. You know, if you're in the military more than a day, you know we ate MREs.
Yep.
And I'm not saying that I hear about the thing about the MRE that has toxic. Let me just say, we have not had anything or heard anything about a claim for MREs due to toxic exposure. We have not. We have not been notified of that. We have not. I'm not saying that it's not going to happen, but as of right now, we have not heard anything. Mm-hmm. But let me just say this. GERD can come from a number of different things. It can come from service if you had acid reflux in service and you were treated for it. But it also can come from medications that you are taking for another service-connected disability. So let's say that you have to take acetaminophen or any type of NSAID for an inflammatory disease, right? And you have to take that daily, or even a heart condition. You take that every day. It irritates the lining of your stomach. It irritates the lining of your throat. Mm-hmm. That can cause you to have, even if you had a hiatal hernia, ulcers, things of that nature, irritates GERD, right? You can claim that.
Yeah. You sure can. And that's something you guys need to write down. Make sure you write that down of how it's affecting you, because you guys don't remember it. Oh, I remember taking a whole bunch of ibuprofen, but you don't remember what it's for and how. You need to write it down. Start annotating stuff.
And I'll give y'all another nugget. The anthrax shot that we had to take, the malaria pills, start doing some research on those, because those have been linked to some of these conditions. So you guys got to do your little research and look up those things and do your claim accordingly.
Yep. Write your notes. Write your lay statement. You're looking for especially the dates of the anthrax shots is very important, and the vaccine numbers. Make sure you write those down as well. Because
and if you had I'm sorry, Herbert. And if you had a allergic reaction to any of that, because the anthrax has been linked to a lot of disabilities.
Okay, guys, we dropping the nuggets tonight. Just make sure you guys are taking some notes so you can come back and watch the video. Okay. Somebody just said GERD secondary to PTSD.
Okay. Let me say, I've seen it claimed.
Yes.
But I get it. You know, when you get anxious, you know, it can cause you to have digestive issues. But it's not, it can't be, you have to say it like, due to the medications I am taking for PTSD or any mental health, I developed this. But here's the part that you guys miss. Documentation. Documentation, right? You can tell us that all day, like, oh, I'm taking this medication, but you don't have nothing in your records that says you had a complaint of that. And so when you send that in and there's a medical opinion sent and it comes back, a lot of times it gets denied because they say there's no link. Though I disagree, and sometimes I fight it if I have the evidence of it, and sometimes veterans list specific medications. Although you don't have a complaint of it, I can go say, well, they're taking this medication for their anxiety or their PTSD, and I will even Google the medication to see the side effects. And I'll send it back to the examiner and say, hey, the veteran noted that he's taking this, and these are the possible side effects that has been listed. And here's the studies. And I can get them overturned. But that's just because I'm a pretty good rater. But a lot of raters don't do that. So you have to do your due diligence to notify what medication you feel is causing that. And they have, with the VA, they have secure messaging. If you get a medication or even an increase, sometimes the medications that they increase for you causes you to have an increase in digestive problems.
Correct.
So you can send a note to your doctor like, hey, you increased this medication. I'm experiencing this.
Mm-hmm.
We can see the secure messaging. Anything you send to your provider, VBA can see your VAMC records. Those messages are a part of your documentation.
Somebody's asking about JP5 and JP8 fuel.
That's toxic exposure. That's not Gulf War. We'll get there. Just hold on.
All right. So we talked about GERD, IBS, the stress, the diet. Naturals gave us a lot of pointers about annotating. Remember, we did a live about a few weeks ago, about 2 weeks ago, about medical evidence and how you can use it, and peer review articles and how it can be used when it comes to your claims. So you guys can go take a look at that. You can research some peer review articles, making sure that it applies to the veterans, and use those to, bring the correlation between your medicine or your diagnosis or your symptoms or your condition. You can use that to as a form of connection. Neurological conditions.
Also, cardiovascular should be on here also. That's one thing. It should have been on, because cardiovascular is one of the things we do for Gulf War also. Neurological could be radiculopathy, but typically radiculopathy is kind of tied to your back. But there's all sorts of neurological conditions that could be tied to Gulf War. So just look them up. If you have them, if you have a neurological condition, and you feel that it's tied to your time in Southwest Asia, file your claim.
So the question is asked, would it be possible to claim sleep apnea secondary to ADD with anxiety and depression?
I'm gonna tell y'all something about sleep. I'm one of those raiders that I don't sugarcoat. Sleep apnea is probably by far the hardest condition to service connect
PTSD
outside of service, because a lot of examiners are saying there's no link. There's no medical link, because sleep apnea again is a respiratory condition.
Yep.
Although you may have chronic pain, or you may have GERD, or you may have whatever. What did they just ask? Oh, ADD. Mental health. Okay. Let's think about this rationally. And I'm not trying to be disrespectful or nothing, but let's think about this rationally. Sleep apnea is a respiratory condition. How is this causing that? How is your knees causing a respiratory issue? How is ADD a mental health? Although it may aggravate it, how is it causing it? You got to look at the causation.
Yeah.
And that's how examiners are going to look at it, just like I just explained it. How is, because a lot of people confuse sleep apnea with sleep disturbance. It's two different things. A sleep disturbance is linked to mental health. The sleep apnea can cause you to have insomnia and tired, because if you wear that CPAP machine and it causes you discomfort on sleeping and stuff like that, sleep disturbance is going to get linked to a mental health, not sleep apnea. So what it would turn into is your sleep apnea is aggravating your mental health, not your mental health aggravating the sleep apnea. Because a lot of times examiner link it to either if you're obese, genetics, smoking, things of that, stuff like that. You got to think about it. We can do something that we call an intermediate step, obesity. So like, say you had a back injury and it's causing you to gain weight, and then it led to possibly you developing sleep apnea. You can do it that way. but trying to link it to something anatomically that is hard. Unless you had a sleep apnea test, a sleep study done on active duty, and you had a diagnosis on active duty, sleep apnea is going to be hard to connect.
Correct.
We can do it to Terra. We can do it to, chemicals and stuff like that. Now, sometimes, depending on the amount of evidence, I have seen it linked to Terra, but it's very few times that I see it. I can only speak for me. I can't say for everybody, but sleep apnea is probably one of the number one things I see on probably about every claim I open. Sleep apnea is there.
Yeah. Sleep apnea is one of the conditions that this summer is going to be take a little turn. Okay, let's see here. I went for ankylosis of the knee secondary to lumbar. I was denied of that claim. However, it showed instability and osteoarthritis as a favorable condition, but again, not rated because the rater referenced, not sure the rest of it. I went for ankylosis of the knee secondary to lumbar. I was denied on that claim. However, it showed instability and osteoarthritis as a favorable conditions. Now, we don't like favorable conditions, but again, not rated because the rater referenced a study saying I didn't mention pelvic issues in my records.
Well, I don't know, but if that's what they told you, so let's look at it. Okay. Your back injury, your lumbar, although as a veteran who has back issues, I know I shift my weight, and sometimes, I put more weight on one side. I get it. But anatomically, how can your back cause you to have ankylosis in your knee? You would have to have some type of trauma to that knee for that knee to be able for you to have ankylosis. And ankylosis has to have a diagnosis, because a lot of veterans claim that, but they don't actually have ankylosis.
You would since 1995. So did you have a knee condition, James? He said he's been walking foot since 1995.
It's going to be hard to, that's why I was denied, because it's hard to link anatomically that, although in theory we know that yes, sometimes, or they probably would have, if they look at your BMI, they link everything to obesity for some reason. But you would have had to have some type of trauma to your knee.
And he said, range of motion was poor.
Right. So just because you have a poor range of motion don't automatically say you have, and they said you had osteoarthritis. Yes. And that's why I said you would have had to have some type of trauma to that knee for that knee to get ankylosis. It's not going to come from your back.
How can I claim my knees to my back?
Anatomically, how can you? Now, knees to back, yes.
Yes.
But back to knees, possibly no.
Yeah. Knees to back, yes. Because obviously you're going to be compensating from one knee to the other, which will cause back pain, right? Because you're putting weight on one side of one knee, which will cause you some back and hip pain, right? Your hip is connected to that joint going down to your knee up to your back. So that's how the connection happens.
Right. Like I said, although, yes, you could be doing the same thing. You could be shifting weight so that your back would not feel the pain and causing stress to your knees.
Yes. You can file that to back. Yes.
But your knees, if your back is already service connected, then you can't do knees to back because your back is already service connected. We're saying anatomically, you could have said if your back wasn't connected and your knees are, and your back you're having back problems because of your knee issues, then yes, that's a plausible service connection. But the other way around is kind of, they're gonna say it's anatomically impossible, basically, for a back condition to cause a knee condition.
All right. Next step. So we get into Agent Orange. So this applies to the Vietnam era and expanded eligible groups to include like diabetes, heart disease, Parkinson's, and certain cancers. Many veterans do not know that they qualify for like hypertension, which is high blood pressure. Was that MUCME? Yep. Peripheral neuropathy. Those conditions are all attached to Agent Orange, right? The chloroquine and the amyloidosis, which is all connected to Agent Orange. Then we talk about the presumptive cancers that are often missed, which is bladder cancer, the chronic B-cell leukemia, the soft tissue sarcoma, respiratory cancers such as lung, bronchus, larynx, and the trachea. And why these conditions go unclaimed is because the symptoms don't appear for many, many years after the Vietnam or the Korea War service. Veterans assume conditions are due to aging and not exposure. Some conditions, like MUCME and the AL, are not widely understood. Many veterans don't go to the VA, don't know that the VA expanded the presumption list under the PACT Act, right? And some conditions require specific diagnostic language that veterans have never been told. So this is where you need to do your research, especially if you are in the Vietnam era. And we don't get to see a lot of like we now getting to see some people from the Vietnam era, but they're passing on, right? So they didn't get the opportunity to have this advantage right here to see all the things that are going on with their body. Because I know a lot of people, they reach out about their dad being an Agent Orange, and by the time they really start to file a claim, their parent passed away, right? So you have to be able to, like I said, these symptoms appear, and you may go many years without even knowing that it's part of, the conditions that you can be rated for VA disability.
The Korean DMZ is included in this also.
Okay.
If you were in Korea on the DMZ, it's like a line. It is presumed under Agent Orange too. Hypothyroidism is on this one too.
Somebody asks, what about rash, fungal infection, scars due to radiation treatment?
1151. That 1151 happened from the VHA. So what happens is, say you go in for a surgery and they leave I'm just saying, like, I'm just giving not in this, but they leave a sponge inside you or whatever. And then you start developing, toxic toxemia or you had, some other things that go on. That would be considered 1151 because the VA's neglect they didn't, or they failed to diagnose you or something like that. That's considered an 1151 claim. That is separate from a VBA claim. You can claim it because the VA caused it, but they will send they'll do like a investigation and they'll have the doctor write their, the report or whatever they had, and then they will have an examiner review it. And typically, if they find evidence that the VA caused it, they will grant the 1151. But if they find that it was due to the veteran's poor care of the wound or they didn't do follow-ups or something like that, they will generally put it like, oh, the veteran failed to, do follow-up care. He or she didn't clean the wound properly. They busted a stitch and never came back, and it developed into an infection, which led to another surgery. so forth and so forth. But if you did go to the VA and you had something and you developed a rash or a fungal infection and you didn't get treated for it and you kept going back complaining, then absolutely file 1151 claim.
Yeah, and 1151 is another name for a tort claim, because you guys are not affiliated really with the numbers. Like, you have to make sure that the disability must be caused by VA negligence. That's the biggest thing, and the carelessness of of the VA. You have to make sure that you have the proof for that. Okay, because I get a lot of people on TikTok be like, "Oh, that's a tort claim." No, it's not. Okay, there's a distinction from the standard claim. It's not like a regular claim. Okay, the VA is not responsible for the condition which was reasonably expected, meaning that it was a result of treatment. Okay, so you have to know how to file it. You have to have the supporting medical evidence and the evidence to show that the VA care directly caused the injury, like Natural just said. Okay, so you have to be able to separate the two. Okay, what do you say, Paul? I'm so glad she didn't ask if I was big enough when talking about ED. Okay, you're trying to be sarcastic here. All right, let's talk about TBI. Okay, earlier we talked about PTSD. We're going to talk about TBI and migraines. Often undiagnosed again and misattributed, common causes include like blasts, falls, or vehicle accidents. Like symptoms include headaches, memory loss, mood changes. Migraines and TBIs, they somewhat go hand in hand because the headache frequency caused by the blast exposure, the TBI, the neck injuries, or the stress that comes from the TBI can cause the veteran to have migraines. Many veterans don't connect their headaches to service because of the TBI. They see the TBI outside of the migraines and they don't know that both of them can be connected together. Migraines are in the top 10 claimed disabilities, but still widely unclaimed. I get a lot of people who are rated as 0% migraines and they don't do the migraine log, or they really don't annotate how the migraine is affecting their daily life, especially if they're trying to reach the 50%, where it has to be the economic impact on their daily life. They still are not able to articulate to the VA how it is the migraines are affecting their work-life balance and their home life balance, how it's affecting their family. A lot of people have the issues with that. Many veterans experience concussion events but never really receive formal documentation. So if you are active duty and you have been any kind of concussion or any kind of thing, make sure that it's annotated and documented, and make sure you get the paperwork, okay? Because sometimes it just get lost in the sauce and you don't know where it's at. Symptoms like memory loss, irritability, headaches often go unclaimed that are connected to TBI. And I know that here lately, the VA has been asking questions about TBI. They've been inquiring about, if you've experienced any traumatic brain injury while in service, if you're having any headaches or memory loss, because the numbers for TBI has been constantly rising within the veteran community. So pay attention to what you are experiencing when it comes to TBI. And you can be rated for PTSD and TBI separately once the examiner is able to decipher the two. Okay, not sure you want to join in and say anything here. Hey, Benny.
No, it's pretty clear.
Okay. All right. So the reason why these conditions that we talked about earlier go unclaimed is because of the stigma. We talk about the stigma when it comes to men filing their disability claims, the lack of information, the paperwork, and how complex it is, and that often deter veterans. Y'all don't know how many times I get on consultations and I have to walk veterans through paperwork. And for me, it seems so simple, but yet so difficult, right? If you need help in filling out your paperwork, do not be ashamed. Don't be ashamed. Just ask for help, because if you answer something the wrong way, it can go in a different path. Okay. The misconceptions of eligibility and the fear of rejection are often common barriers. I did a lot of people, oh, I get an OTH. Oh, I got a general. Oh, I got an uncharacterized. They said I'm not eligible for benefits. Who told you? Oh, the lady that answers the phone at the VA. And I'm like, what? You are eligible for benefits. Oh, I am? Call back again. Guess what? Oh, yeah, they said I'm eligible for benefits. So sometimes hang up the phone. If they tell you something and you don't, and it doesn't sit well with you, call back again. Call another VA location, or go to the VA office and ask questions, right? It's one of the biggest things that veterans always get deterred, especially when they get separated with like an OTH or dishonorable based on what you were discharged and your code. You can still get benefits. I have people that only spent 3 weeks in the military, they get benefits. Some people spend 6 weeks, they get benefits, right? So don't count yourself out because of the complexity sometimes of the questions. And sometimes, like you say, Skims, not knowing how to articulate your thoughts, aka don't know what to say or how to say it's very much so a struggle for veterans, right? And sometimes I know they'll be like, how you able to just come up with your thoughts just like that? Sometimes you're not able to articulate it because there's so much going on up here that you're not able to write it on paper, and it's understandable. So take a deep breath. When you have a chance, start jotting things down on a piece of paper, and then you come back and put it all together. That's one of the suggestions that I often give. Hey, OT, I have a TBI injury in my SDR, but denied for my TBI claim. So, Danda, we will have to see exactly why they say it was denied. So, the lack of documentation during service is why conditions go unclaimed. The stigma around mental health, and we talked about it earlier in lengths, about especially among men not knowing the conditions and how they can be secondary. Assuming symptoms like normal aging, for example, like memory loss or neurological conditions, those are things that go unclaimed because if you actually were in a blast or something and you would probably say, well, I'm 65, I'm getting old, my memory is losing, when it could attribute to your TBI, right? So you have to think about those things and the experiences that you went through while in service and try to apply them to, different things, not realizing that the VA compensates for mild or moderate symptoms. Yeah, it doesn't always have to be chronic, right? So it doesn't always have to be chronic sinusitis or chronic rhinitis or chronic headaches or chronic. It can be mild as well, right? And I know recently they had the whole medication situation and people was like, oh, I'm gonna stop taking my medicine. You better take your medicine. Take it. Because if it's mild now and you don't take your medicine, it's going to go from moderate to chronic. And I don't think you want that, right? So take your medication. Take good care of yourself. It is so important that you take good care of yourself. Okay? Stop thinking about what other people, because guess what? And I want to say this, no two claims are the same. Okay? So if you think like your buddy claims something and now you're trying to claim something and it's not working out for you, it's because he probably had a whole lot more medical evidence and he had much more symptoms and stuff like that than you did. But you cannot compare your disability to somebody else's. Anything you want to say, Nacho, before we get into the secondary conditions?
So when we talk about, and I think we did a on the dishonorable and the upgrades of the discharge.
Yes.
So OTHs are considered honorable under VA for grants.
Right. Okay.
Now, generals are also considered honorable. Now, when we talk about OTHs, some OTHs have caveats to it, depending on how they coded you. So if you have like misconduct, serious, then some of those require a COD, which is a character of discharge, and it's an administrative thing that the VA does to determine if you had like a certain period of your enlistment was honorable, and then you had a second period, and that period is considered barred from benefits, which is a dishonorable period because of your offense. You can still be service connected, but it would have to be under the first period that is honorable. Unless you do a discharge upgrade and you had some type of mental, and a lot of times people had mental crisis, right? So there could be some people, there could be something that happened on your first enlistment. You were an ideal soldier, something happened. Then you start seeing the evaluations note the soldier member disrespect of command, soldier member didn't wasn't at his place of duty, soldier member coming neglectful of care. Something happened for that soldier to diminish like that, especially if they had great reviews before. So now those are being looked at and upgraded because people had underlying mental conditions. They start drinking a lot, they're getting DUIs. Those are markers. So just because you have a other than honorable or you have a dishonorable discharge doesn't mean you can't get benefits now. So go back if you and even TBIs, MST, all that stuff is included, under the don't ask, don't tell policy. Those things are now being looked at. So if you fall in one of those categories, go back and try to get a discharge upgrade. But it doesn't necessarily bar you from benefits just because you have an OTH or a general.
Yes. I hope you guys, and we did a live about that a few weeks ago. You guys can go back and view that about the different types of separations and how you can apply. I did a live about discharge upgrades. What is needed for discharge upgrades? I get a lot of people that reach out about discharge upgrades. The rules have changed. If you have like a PTSD diagnosis or any type of MDD, TBI, we can use that medical evidence to do a discharge upgrade before the board of correction. All right. So let's get into secondary conditions. The lack of information, the paperwork complexity that we talk about often deter veterans. The misconception about the eligibility and the fear of rejection are some common barriers that men often and women often deal with when it comes to filing for secondary conditions. These are some of the most commonly missed claims: secondary depression, anxiety from chronic pain. And I hope you guys are writing these down because you can file these as secondary as well. Secondary sleep apnea from PTSD or weight gain, secondary radiculopathy from spine issues, secondary GERD from medications, and veterans often file the primary conditions but forget the secondary ones. Okay, so let's look at, I know that you want to talk about we talked earlier about the radiculopathy from the spine issues and the GERD from the medication. So if you've been taking that good old, Motrin for years, you can look into that if you're having some GERD issues, right? If you have chronic pain, the chronic pain could lead you to being depressed because you're not wanting to go outside, you're not want to, be around people, you're not interacting with your family. That's the depression from chronic pain. That can be a secondary. So pay attention to, your secondary, especially when you're climbing from that 90 to that 100. Secondaries are mainly the things that take you from that 90% to that 100 because you're able to go back and look at everything that you filed as service connected and then try to see what secondaries come into play off of those service connected claims. Anything natural?
Nope, you hit it.
Okay, we're rolling tonight. So how to know what you might be missing. So a good step is to look at any chronic pain that you've normalized, right? We talk about if you were saying that, hey, I was involved in this, but it's not that because I'm growing old. You have to go back and look at, is this really contributing from old age, or is it because I had a TBI, or suppose I had a rollover accident, or suppose I was deployed somewhere. So you have to look and see where that condition comes into play, or where that pain is coming from. Next is your sleeping issues. If you're snoring daytime, or having fatigue, sleep issues, your mood is changing, you're irritable, you're anxious, you're depressed, your emotions are just fluctuating everywhere, you're not able to eat, you have a whole lot of indigestion, digestion issues, you have like neurological numbness and tingling in your hands and your feet, stuff like that. You have headaches, migraines, and along with breathing issues. These are steps that you think because you're growing old that is due to old age, when in actuality, these are things that you can claim secondary to your service-connected disabilities. And too often, veterans are missing out on the small things, and they're going for these big elaborate things, but sometimes you have to focus on the smaller claims, right? Hold on, I see a couple questions here. Look up the 38 CFR 3.1 point, skins, chronic insomnia disorder, SMCL 2680 done. Increase of sciatica with foot drop. Will the foot drop be considered since it's sciatica increase?
The foot drop will be, it'll be considered.
Okay. I tried to get my former worker to reach out to you. He was mistakenly listed as contentious objector by the Army, needs to get a discharge upgrade. Oh, yeah, most definitely. Steven says, all of you. So, Steven, you got chronic pain, sleep issues, mood changes, all of that. Hey, Squish. You're something else. Anyway, let's keep going. How to start a claim. This is very important. Very important. How do you start a claim? Okay. By first getting them medical records. That's the first thing. Okay. Get the medical records. Then you're going to gather your evidence. Gather together. Meaning, guess what you're going to do? You're going to sit down with that medical record packet, book, whatever it is, and you're going to go through it page by page. Okay? You are not going to rely on somebody else to tell you what to claim. You have to know what's in your medical records. Too many people just say, oh, here's my medical records. What happened to looking through your own medical records? And then when you don't go through your medical records, it's the CMP examiner's fault and it's the rater's fault, but the veteran never takes blame. So you didn't go through your medical records at all. And guys, I am very straightforward and to the point. I tell you what you need to hear and not what you want to hear. And Natural does the same thing. So you don't go through your medical records, number one. You go ahead and drop it off over there at the VSO, DAV, VFW, American Legion, whatever. Your accredited officer, you do all that. But you never take the time to go through your records, and you expect somebody to go through your records to pull out exactly what you should be claiming, and then you get mad at the CMP examiner and the rater. Make it make sense. But you played no part in doing anything that for your claim, besides going to the CMP examination. Yep, I said it. So what you need to do is gather your records. Number one, go to the NPRC website, get your medical records. I don't care if it's taken from now till thy kingdom come to get it. Go up there on the NPRC website and request your military medical records. Go up there and get them. Set a timer on this, because if you're going to be scrolling on this on TikTok or YouTube, the least you can do is set a timer for 5 to 10 minutes to go through a couple pages a week. Okay, if you do 5 minutes, 3 days of a week, you can go through your records. But then you don't want to go through your records, but you want the rater to go through 3,000 pages to find out something that you are claiming. When if you went through your records and you put them to the side and you highlighted it, it will be so much easier for the rater to find the information, right? So they don't have to go through 3,000 pages to find it, because like Natural say, every rater is not going to go through it. Okay. So if they don't go through it and you don't go through it, but it's somebody else's fault, it's the examiner's fault and it's the rater's fault, but you never take any blame. Right. So every single consultation I do, have you went through your medical records, right? Did you sit down and write out every single thing that you have, every single diagnosis, every single event? Okay. And then you take those records, whatever you're filing for, then you will upload those records when you file your claim. I guarantee you, Natural is a rater, and she will tell you, when you highlight your own stuff and you upload those medical records, it is so much easier for her to go ahead and rate you instead of trying to dig down in Timbuktu to find it. And if you don't know your own claim, your own records, or nothing about everything that's happening to you, why is it somebody else's fault except you? I'm just saying, right? So
I would say in this situation, you are your best. You're going to take care of you better than anyone will take care of you. You should not put your claim into anyone else's hand and then expect them to do right by you, because generally the information goes off of service connection, goes off of the evidence of record. You got to take ownership of your own future. So it would behoove you to start with, before you keep filing claims, or if you've never filed a claim, get your service treatment records, have current treatment on what you're trying to claim, and keep up with your treatment.
Yep.
Check the box. You know, treat it like you treat your job. You go check in, you go clock in every day because you want your paycheck. If you want a disability recognized and you want to be compensated for it, you got to do a little bit of work.
Yes.
Now, let me say this. You have good people who work in the job, and you have people who are just a company person that's going to check the box, whatever that exam say, they're going to go. They're not going to go back and double check. I'm just different. Now, but in theory, you would hope you get someone that would do their due diligence to check your service treatment. But it is a lot of work to go and search and review and annotate and do all of those things to try to get you service connected. When I do a claim, I think of myself and how I would want someone to do my claim. But I did my own myself way before I became in the situation I'm in. But let me say, I took the time, got my records, annotated. I made a table of contents, and I showed what I was claiming, what page it was on. Every time, if I was claiming back, knees, or whatever, every page that was indicated on that I complained about it, I put that on the table of contents. So when I submitted my claim, all they had to do was like, oh, she's seen this, and that. She had this, and it was no question. But that's just me. But sometimes we gotta do things that we don't want to do, but it'll pay off in the end. So, and that's the thing too. So if something gets denied and they say review of service treatment records or VA file, there was no evidence of this claim condition. You have the evidence already. So if you file a supplemental, you can say, no, you overlooked, the VA overlooked that I had complaints of this on this day. I was treated for this, and I was given medications of that. You have that as your rebuttal.
Yep. The right said, how do you know you have enough evidence?
So to start with, you have to meet the 3 elements, which is a in-service event, a diagnosis, and current treatment, current diagnosis. If you didn't have any of that, you would have to meet what we call presumption. Now, we can use lay statements as symptomology and credible as an in-service event. And the threshold for an exam is kind of low. So we can, say, hey, the veteran is competent to tell us something. You're not competent to diagnose yourself, but you are competent to tell us that you have this symptomology. Now, if the information is just not there, it's just not there. But what we do is we look at every avenue to try to service connect you, depending on what it is. At least order you an exam and a medical opinion. I hope that makes sense.
That makes sense. I hope it makes sense for you, Mr. The rights. Okay, so here's a couple of resources. The VA.gov benefits page, very great resource. Local veteran service officers, crisis and mental health support resources. I would say there's social media, but sometimes social media can be just so taxing on the mind. There's all these different people giving all these different information. Some people don't do research. They just say stuff out the corner of their eyelids. And so you go ahead listening to it. For example, I've seen a few videos about SMC, and a lot of people are showing, well, I'm getting, like, I seen the guy the other day, he was getting like almost $12,000 because he's getting SMC. Okay. As soon as veterans see that he's making this amount of money, they want to ask, hey, how did you get this? How did I want to do this? The veteran shared the information, and all of these people are going to file for this SMC because why? In their mind, they're thinking somebody else got it. I got to be able to get it too. Just know, and I know you've heard Natural say this 10,000 times. You guys come looking for them. They don't come looking for you. So if you get a reduction or a proposal to reduce or whatever the case may be, because you go looking for pay that you're not even entitled to, it's your fault. It's your fault. Okay? It's definitely your fault. Let's see here. Please state the importance of using the accredited VSO. Yes, an accredited VSO have the ability to look at your files in a VBMS. A VSO does the same way. Just please avoid claim sharks. Okay? Claim sharks, avoid them. If you have not been reading the news, claim sharks, they've been getting cease and desist letters from the VA. Lots of things are happening behind the scenes. Just make sure that the person who you are using to file your claim with has the security measures in place when it comes to accessing your information and so forth. Let's see here.
Can I add something to that?
Yeah, sure.
What I would say is everyone's case is different. Your case is not like your buddy's case. Just because your friend or your fellow veteran got service connected for something and they told you the way that they did it, it all goes on your evidence of record. You can claim, I've seen it, 10 veterans can claim the same thing and maybe 2 or 3 get service connected for it. Because why? They have the evidence of record to support it. And that's what people are missing. You can claim whatever you want to claim. Just know your evidence of record has to support that claim.
Yep.
It has to support a service connection. All 3 elements have to be met. The nexus has to be met.
Yep.
That's what you got to stop listening to, because I myself am on social media and I see a lot of people come live. I see a lot of people post things and I'll be like, that is so wrong. That is so incorrect. And the thing is, they will argue with me because they don't want veterans to know the truth, because what happens is that cuts into their business. If we're telling you the way to do it, without hiring someone, paying them thousands of dollars. They don't want that. They don't want you to know that you can do this all on your own. They're not taking you from 0 to 100. Your evidence of record is taking you from 0 to 100 or 0 to 50 or 0. They're not doing anything that you can't do.
Correct.
They can you can file the forms yourself. You can review your STRs yourself. You can get your own nexus yourself. They're not doing anything that you can't do. But many people believe the hype that they're spitting out there. These people that they get the back pay for, or they get this approval from 0 to, it's nothing they did magical. It's nothing they could do. They can submit all day the form, the nexus letter. If the evidence of record is not there, it's not going to happen.
Mm-hmm. Mm-hmm.
So even if they tell you, okay, we're going to get you this, whatever, and you get 10%, their job is done, because they said they were going to get you a percentage. They didn't guarantee, although I see the ones were like, let us take you from 0 to 100. All these SMCs, past SMCS, anything past that is really, really hard to get. You have to have so much wrong with you to get those higher SMCs. Stop letting people talk you into or making you think it's easy to get additional SMCs or aid in the sense. It's a criteria for everything.
Yep. And the VA is now cracking down on finances, so you're not going to be able to slip through the cracks to get anything. Nothing. And I'm just going to say this, and I mean it not in the way that it's probably going to come out, but just because you work to get yourself 100% does not mean that you're a guru to get somebody else 100%. I said it. Yep. Too often I see, oh, I work to get my 100%. Oh, I can help you get your 100%. She just said it. No two claims are the same. And I'm not saying that you can't help somebody else to do their claim, but too often, okay, just because you got your 100% your way and you had your diagnosis and you put the work into it or whatever, you can't do it for somebody else if you don't know their elements. You don't know anything that they went through. You can't do it for them. So you can lend them an ear or help them doing the research in the 38 CFR, but as far as doing the claim, no.
You can't go to the examination for them and you didn't walk their journey. Mm-hmm. So again, everyone's journey within the military, everybody's experience in the military, and their thought process of the military is different from yours. Your claim process is going to be different. Although, like her vets just said, they can walk you, but just because you have 100% does not make you an expert. Though people will try to discredit those who do know, because again, you're cutting to their profit. Me personally,
mm-hmm.
I'm gonna listen to someone that I know probably do this on a regular basis. They have the insider. Just because you can pull up the 38 CFR M21 and the part 4 to look at what you need to get a certain percentage, your interpretation of the law and what the law is and how it's applied to your claim is different.
Mm-hmm. Yep. And you don't even have access to their files. So you don't even know what they filed before, what they did, supplementals, HLRs, nothing. You're just going off of what they're telling you. It's just going to be a crap show. I don't have a current diagnosis. We're starting off on the wrong foot, working class. Because one of the 3 elements are what? Diagnosis. Because I can't afford to get evaluated right now. Would it be okay if I provide the other 2 documents and have the CMP exam address my current condition?
Okay. So, one, you can go to the VA and sign, even if you're not service connected, you can go to the VA because they do that. They can go off a means test. Mm-hmm. They can evaluate based off of your income and allow you to have treatment. You just take your DD-214, and verification of income, and then they'll do what they call a means test to determine if you're eligible for treatment there.
Mm-hmm.
As far as you would have to, whatever your diagnosis is, depending on which way you're trying to link it to service, and you already said you don't have a diagnosis, if I'm remembering correctly on the question.
I said I don't have a diagnosis, correct.
If it did not happen in service and you didn't have a current diagnosis in service, how are you trying to link it?
Mm-hmm. Correct.
What is the nexus?
Where's the connection? Can you file a supplemental on an old claim?
Yes.
Yeah.
You can file a supplemental on anything that you've ever been denied for if you have new and relevant evidence to support it.
Correct. Right. I think we covered all of our topics tonight when it came to the 6 things that men really don't claim. And if you are just tuning in, we talked about 6 conditions that men usually don't claim. We discussed PTSD, musculoskeletal, Agent Orange, Gulf War, TBI, migraines. One of the ones that we really didn't get into is ED. So if you have ED, do not be ashamed. You need to file your claim. Okay. A lot of common mistakes that veterans make is filing without evidence, not explaining the impact that it has on your life, ignoring secondary conditions, and downplaying your symptoms. The VA can only rate what you show them. Okay. They can only rate what you show them. So if you don't show them, or if you don't have the documentation to show that you're experiencing this, they cannot rate it. Say this. A lot of male veterans push through pain and symptoms. We've talked about this before. They push through the pain and symptoms. They want to tough it out, and we're not going to be toughing it out. We're going to go to the doctor, get the treatment we need, get the medication, get the medical evidence, and have the 3 elements to file your claim. But pushing through doesn't mean that it's not affecting you. If it's affecting you, it's affecting your family. Remember, we talk about the mental health, the PTSD, the MDD, the depression, and the anxiety. The fact that it plays on your role, on your family, it is very taxing on the family. Not only you, you might not see that it's affecting your family, but it's affecting your family. And it doesn't mean that you should not be compensated for it. Okay. You deserve to be compensated for every single disability that is service connected. Okay. So do not think that you are going to tough it out and it's going to be okay, because guess what? The older you get, the worse it's going to be. Okay. Remember, when it comes to TBI, you have to look at the symptoms of TBI compared to old age and make sure that it is not some service related that you endured in your service, during your service time. All right. It's imperative that you pay attention to the different type of neurological conditions you're experiencing, the headaches, the forgetfulness, the migraines, etc. Okay. Those are things that you have to pay attention to, because you might be attaching it to old age when in actuality it's attached to a TBI or a concussion or something that you have endured while in service. There are so many common diagnoses that a lot of veterans don't claim. And most important, the conditions that male veterans deal with, they really don't care or care to even file them. If it impacts your life, I say this all the time. If it impacts your life, it impacts your health, it impacts your ability to function, it impacts your family, it definitely matters. And you deserve to be properly rated. You deserve to be properly rated. Men respond in a clear mind and straight to the point when they are healthy and they are comfortable. If you are not healthy, if you're not taking care of yourself, then guess what? You are not going to respond clear. You're not going to be there for your wife or your son or your children, any of that. TBI is traumatic brain injury. You're not going to be straightforward and to the point. You are going to miss out on so much that your family is putting forward, and you're not going to be there. I definitely would like for men to step up and go to the doctor. I would. And if you're a man and you have a friend that's not going to the doctor, encourage them to go see a doctor. Encourage them to go get PTSD treatment, MDD, TBI, whatever it is. Encourage them if they're experiencing back pain. Go see a doctor instead of trying to tough it out and go to work every day. Because guess what? When you go to work every day and you don't go in and something happens to you, that job is going to replace you and put you a little obituary thing on the board and keep moving. Your health is your wealth. It's important that you are healthy so you can be here for your children, your grandchildren, your family, and share in the joys together and enjoy your retirement and your disability. If you're not here, you're missing out. So I said all that to say your health is important. If it impacts your life, if it impacts your health, if it impacts your ability to function, it matters and it should be claimed. Okay? Anything from you, Natural?
No, I just, like I said, I just want everyone to, you served your country. And if you have some injuries and you are suffering, please seek help. Please do your due diligence when you're filing your claims. Please know that you're not alone. There's hundreds of thousands of veterans going through the same thing you're going through. They're going through the same process, and educate yourself on the claim process so you don't get taken advantage of by these people that are just wanting your money. You're doing this for your family, your future. Just take care of yourself, guys.
Yeah. So on Friday night, we're going to talk a little bit about DIC. Okay. We're going to talk about the 10-year, the 20-year rule, and the 5-year rule. We're going to talk about that. We're going to talk about DIC because I get a lot of comments about if I pass away, is my wife going to get my disability or my husband's going to get my disability? So I think it's something that we should talk about, including the 5-year, 10-year, 20-year rule and how it applies. And we'll just cut it up on Friday night. So I thank you guys for joining. Don't forget to like, share, and subscribe. I am so close to my watch hours, guys. I appreciate you for the love that you've shown me in growing this channel and Natural as well, because I know if you see me and you don't see her, you're trying to figure out where she's at, where FF is at. Guess what? We're going to be here, guys. Don't worry. Okay. LJ, awesome. Thank you for choosing to go to see a mental health therapist, and you have a CMP, and all will go well. Just tell the truth and be straightforward. So much appreciate what you are doing for the community. Awesome.
Yes, and we like doing this thing. So if you guys like us coming up here and seeing this type of content, please subscribe to her channel. Please look for us when we come live, because we don't mind doing it. Although our lives are super busy, we still take time out to come educate our fellow veterans, because we are tired of the misinformation getting disseminated out here, and veterans getting taken to the bank on their back pay, and just giving up their retirement pay, their TSP. Stop doing that. And like I said, if you like what you're seeing on this channel, please like and subscribe. And thank you guys, and have a good evening.
Thank you guys so very much. It's definitely been a pleasure being here tonight. We'll definitely be back on Friday night. I think on Friday night we usually do between 9 and 9:30 p.m. Eastern Standard Time. Hit the like, everybody. Share with everyone here. It's definitely been a great space to come and enjoy the conversation. It's much better than TikTok, so we enjoy coming here. So see you guys on Friday night. Have an amazing week. Share the information that you've learned here tonight with another veteran. And guys, I'm going to be creating a Zoom class where we can sit down one-on-one and you guys file your claims, walk you through it, and show you how easy it's going to be just to file your claims in the comfort of your own home. So stay tuned for that. Have an amazing rest of the week, and we'll see you on Friday. Thank you, HVV family.
You're not alone, you got a voice. Stand strong, stay informed. Her vet voice.